I was facing this problem that I didn't really know how to solve. I am a chemistry professor from Maryland, and I lived here for about 5.5 years. I usually wake up pretty early and go to work. I have a pretty demanding job. I struggled with polycystic ovarian syndrome, and that had a big impact on my ability to keep up my energy level and stay active. Throughout the course of about 2 years, I was able to get a handle on my PCOS symptoms, and the weight that I had gained came off, and I was really able to be energetic and enjoy life again. And the only thing that I wasn't happy with was the way that some of my body had readjusted after I had lost some weight.
She is very strong emotionally, and she does not like to break down, but I could tell there was always something lingering.
I made the decision to get a breast lift and augmentation so that I could look as good as I was feeling. I talked to my doctor, who would listen and let me be my own advocate rather than dictating this is the next thing you'll do. Especially read a lot of horror stories about people who, after surgery become reliant on pain medication, and that's something that, can ruin your life. Then we were sitting in my surgeon's office and sort of going through, the different treatment options, and one of the line items that he was showing me was Exparel. And so he actually, said, "Are you familiar with it?" And we said, "Well, yes." My husband works for the company that makes it. He was my advocate when I didn't know I needed an advocate. He was my biggest supporter. Oh my gosh, I'm getting a little emotional about it, but he kind of pulled me out of the darkness, for sure. My recovery, I think overall went very well. I had pretty much no pain the day of surgery. I could get dressed and I could walk around and I could do the simple daily tasks that come along with everyday life. Someone, seeing me walk around the grocery store probably would have never known that I had surgery a day or two ago.
She had surgery on a Thursday, and we were in South Carolina on a Saturday morning. She was comfortable enough, even though she was 2 days post-op, because she was still having that control from Exparel.
Without Exparel, I might have been subject to opioid dependence or addiction after surgery. This is my Exparel story. I encourage you to share yours.
Indication and important safety information. Exparel is a one-time injection into a surgical area in patients 6 years or older to reduce pain after surgery, and in adults as a shoulder nerve block and leg blocks to reduce pain in a specific part of the body. Safety and efficacy in other nerve blocks are not established. Exparel may cause a serious condition where too little oxygen is delivered to blood cells. Get immediate medical attention if you experience pale, gray, or blue-colored skin, headache, rapid heart rate, shortness of breath, lightheadedness, or fatigue. Temporary loss of sensation or motor activity that may last up to 5 days can occur. In adults, the most common side effects are nausea, fever, constipation, headache, and vomiting. In children, the most common side effects are nausea, vomiting, constipation, low blood pressure, low number of red blood cells, muscle twitching, blurred vision, itching, and rapid heartbeat. Tell your doctor if you or your child has liver disease, since this may affect how the drug is eliminated from the body. Please see full prescribing information at exparel.com/prescribing-information.pdf.